In this video, we are going to discuss urinary incontinence in women and natural remedies to help manage or eliminate the condition. If you are a man dealing with urinary incontinence, be sure to watch our video that is specific to urinary incontinence in men. Please note that urinary incontinence is not the same thing as overactive bladder. While the condition is more prevalent among the elderly, an overactive bladder is not a normal part of the aging process. It affects women and men of all ages, even children. Urinary incontinence occurs typically as people get older, yet it is not an inevitable consequence of aging. If urinary incontinence begins to affect your daily activities, don't hesitate to see your doctor or primary healthcare provider. She or he will be able to recommend the level of treatment necessary. It may be that simple lifestyle changes can ease or stop your urinary incontinence. As we mentioned earlier, as we age, many people experience occasional, minor leaks of urine. Others may lose more moderate amounts of urine with increased frequency. There are a few different types of urinary incontinence. Some may experience stress incontinence, where urine leaks because of pressure on the bladder by coughing, sneezing, laughing, or lifting something heavy. Some people may deal with urge incontinence. This is when you have a sudden, intense urge to urinate followed by an involuntary loss of urine. A third type is overflow incontinence, where one experiences frequent or constant dribbling of urine because the bladder doesn't empty completely. An example of functional incontinence would be someone who has severe arthritis and may not be able to unbutton or unzip their pants quickly enough. If your doctor or healthcare practitioner deems it necessary, there are medications and surgeries that may help incontinence, depending on the cause. Here, we are discussing only natural options such as exercise, lifestyle changes, and possibly some supplements that may help. Let's start with lifestyle changes. Consider an elevated toilet seat. You might be surprised at how many people avoid the trip to the bathroom, even at home, because they struggle with sitting or rising to stand with conventional toilets that are low. An elevated toilet seat will make restroom trips safer as well as easier. Bladder training requires a little more planning, but can very quickly become a part of your regular routine. This involves learning to delay urination whenever you feel the urge to go. You might try to hold off for 5 minutes in the beginning. The goal is to extend the time between toilet trips until you are urinating every 2 to 4 hours. Keep a diary and discuss goals with your doctor. Another way to manage or eliminate incontinence is to schedule toilet trips. This means going to the toilet according to the clock, rather than waiting until you feel the urge to go. Plan to go every 2 to 4 hours regardless, even if you do not feel the urge. Another natural remedy is managing your fluid and food intake. This can have a surprising result on controlling urinary incontinence. However, this does not mean that you should cut back on the amount of water you drink. It means modifying your dietary habits to regain control of your bladder. For example, you may need to avoid or reduce the amount of alcohol, caffeine, or acidic foods you consume. Pelvic floor muscle exercises, known as Kegels, strengthen the abdominal muscles that help you to control urination. Imagine that you're trying to stop the flow of urine. If you use the right muscles, you will feel a pulling sensation. Exercise your pelvic muscles by pulling them in and holding for a count of 3, then relax for a count of 3. Perform 10 to 15 repetitions each time you exercise. Do this at least 3 times a day. It may take up to 10 or 12 weeks before you notice an improvement in bladder control. If you are overweight, losing weight is an important step toward reducing the severity of your incontinence. Excess belly fat puts pressure on your bladder. In addition to these natural interventions to deal with urinary incontinence, you may also need to consider taking extra care to prevent skin irritation. Use a soft washcloth to clean yourself, and whenever possible, allow your skin to air dry. If you feel the need to use special cleansers, discuss this with your healthcare provider. It's wise to avoid frequent washing and douching because this can neutralize your body's natural defense against bladder infection. Consider using a barrier cream to protect your skin from urine. We have enjoyed bringing you another video, and thank you for watching this video to the end. The tips and suggestions mentioned in this video are for general information purposes only, and should not be construed as professional medical advice. It's important to consult with your physician for medical advice regarding urinary incontinence, to ensure that it is not a symptom of an underlying condition. Always consult your doctor or a professional healthcare provider if you have any specific questions about any medical matter. Is there a particular health subject you would like to know more about? Leave us a comment and we'll be happy to put together a video. Keep an eye out for our video regarding urinary incontinence in men. If you have learned anything from these videos, please support our channel by giving us a like, subscribing to our channel, and hitting the notification bell.